I'm Kristen Amaral, a Senior Product Manager at Mobile Heartbeat. I'm joined today at HIMSS 2026 by Dr. Annabaker Garber, Chief Clinical Officer at Mobile Heartbeat and former CNIO at HCA Healthcare, as well as Kathleen McGrow, Chief Global Nursing Innovation Officer at Microsoft. We're here today to discuss how clinical communication and collaboration is affecting nursing workflows in the ever-evolving AI climate.
1 year later, how has CC&C scaling evolved, and has the growing tool landscape become more manageable or more complex?
I think ironically things have gotten worse, not better. I just heard yesterday an interesting statistic that 1,300 new AI-driven medical devices hit the market last year. So the nurses are dealing with more technology, not less, and staffing levels have changed in that nurses typically are taking care of more patients, not less. So they have new things to learn and more patients to take care of, and I don't think their cognitive burden is getting any better.
Kathleen?
I think that I agree with Annabaker that it has gotten worse in that we have so many more technologies that are coming to market, and the nurses are being asked to adapt continuously, and they're not necessarily being set up correctly for the ability to do the change management processes, or they may not have a good understanding of the technology, and it's just being kind of amplified based on all the other technologies that they're utilizing. I think that we're really looking at, if we have the ability to look at how adoption matters within our healthcare organizations, then we have a better opportunity to help alleviate some of that strain. But at this point in time, I do think we still have a lot of strain. I also think that we've seen a lot of things within the workforce recently. We still have an issue around we don't have enough workers, we don't have enough frontline nurses, we have inexperienced nurses that are going into the management level. Even advanced practice, we're seeing that they have less requirements to get into advanced practice, as well as having the ability to adopt that technology and change. So you need the more experience to kind of help with that, and we're losing some of that experience, and we're also seeing a rash of retirements based on really nurses just aging out or having come to the point in their career where they've just decided that they're frustrated and they've decided to leave the bedside.
Does the cognitive load and constant interruptions nurses face feel any better today, or are we still struggling with the same issues?
So I actually do believe that the industry is realizing we have a patient safety and a workforce sustainability issue, and they do see the problem with cognitive burden. I believe that we have tools that have the ability to assist with that cognitive burden and alleviate it. Again, it gets back to change management and how are we going to help the staff, the nurses adopt and look at the overall workflow that they have. I think that we have to understand better the workflow, and I think having the ability to understand from the nurses what issues they're running into is really important, and having a better understanding of that, and then having them participate as we look through identifying solutions.
Thank you. Annabaker?
I think that the new tools that are coming on the market around AI, when they become more mature and can really provide insights and automate certain kinds of workflows, that it's going to have a bigger impact on the cognitive burden. And I think it'll be easier not to interrupt the nurse because the information can flow in a different way. It doesn't have to necessarily go through the nurse. So I think there's hope on the horizon, but we have to get those tools to mature.
A year later, with AI now generating even more alerts and notifications, how do we prevent this problem from getting worse? What have you learned about managing this?
I think this is a really important problem, especially for a communication system. And at Mobile Heartbeat, we're taking this quite seriously. We've developed a provisional patent that will help to prioritize alerts and text messages and bubble up the most important things to the top of the list. We think that will help make it easier to know what kinds of things to pay attention to. Acute changes in the patient condition, necessary conversations with physicians and other clinicians, and then the social conversation at the bottom. I think that we're also working hard to integrate with all kinds of systems so that the information comes through at one point and there's not so much mental switching that's going on, and those integrations will be very important in terms of helping to prioritize the alerts.
Kathleen?
So I think I agree with that. Having the role-based and situational alerts are very important, and that's why it's so important to have a solution like mobile heartbeat that can actually help to manage that. We want to try to decrease the interruptions and decrease the cognitive load. So when you have the ultimate ability to be able to manage them better, then you have the ability to better understand the cognitive load that's on your nurses and be able to decrease that cognitive load. The other thing is that there needs to be a specific governance around the artificial intelligence. So having the ability to be able to weigh into that governance and ensure that you have the safety and quality that you require for your patients is the utmost importance, because that is our primary role as nurses, is to care for our patients in the safest way.
We talked last time about the shift from basic nurse call to more complex workflows, like patient movement. What's the next big step forward?
We think that integrations are going to be an important form of tackling complexity. So, for example, we're integrating now with Microsoft Teams. So the teams in the hospital that are using Microsoft Teams to communicate, like the IT teams and the HR teams and the administrative teams, can seamlessly get a hold of the clinicians and vice versa. And that way nobody has to leave their native system. We've got other integrations with things like scheduling systems and nurse call and service ticketing items, so that we can just make it easy to put everything in one place.
Kathleen?
So I will say that we're seeing this orchestration across people, systems, and time to help decrease that complexity, and also the utilization of ambient intelligence to be able to use ambient to kind of remove some of the friction around the keyboard and the mouse from the nurse's workflow. They have the ability to really be more, have the ability to have more timely documentation, or have the ability to have better communication, because we talked about collaboration, communication, and care coordination, and that's really key when you're taking care of the patient. So I believe the orchestration of all of those processes is what we're going to see really changing in the future.
Yeah, and we're also thinking about building, we're more than thinking about, we are building in voice control into the Banyan platform. So to remove the friction of interacting with your hands with the phone, being able to use those voice commands to accomplish communication tasks.
The value of CC&C really grows with adoption. Can you share an example of an organization that got adoption right, and what made the difference? What made the difference?
I think the most profound example of enterprise-wide adoption is at HCA Healthcare. They have 190 hospitals, and the mobile heartbeat platform is integrated everywhere in all 190 hospitals. It's not just the nurses that have it, it's all the clinicians and the care teams that support the clinicians. So environmental services, food services, the therapies, the security people. So those who take care of the patients directly, and those who take care of the care teams. And that adoption allows the Banyan and platform to be completely integrated in all of their workflows. And so that adoption has led to all kinds of improvements. 32-minute faster transfer from ED to the floor, a 40% improvement in the answering nurse call systems, saving more than 30 hours a shift in terms of being able to get a hold of large groups of people that need to get the same message at the same time, and the countless number of microprocesses where it's just easy to ask somebody a quick question and get your answer immediately.
How is CC&C evolving to support virtual care models, like hospital at home and remote monitoring? Where do you see this going over the next year or two?
Virtual care is being proven in lots of situations, whether it's a nurse at a distance who's doing admissions and discharges within the four walls of a single hospital. But many organizations are thinking about scaling it so that those virtual nurses are in a center and taking care of patients across multiple hospitals. There are organizations that have large transfer and patient placement centers. There are hospitals that are developing specialty care such as wound care or nutrition care, so that they can reach a lot of patients without the nurse having to travel so much and making them work more efficiently. And those folks who are providing care at a distance really need to be part of the care teams that are at the bedside. And so a CC&C platform has to make it seamless for those folks to be able to communicate to the care team at the bedside, and for the bedside team to be able to find those folks who are providing care at a distance. So we're working very hard to make sure that they're seamlessly integrated, that they're seamlessly part of the care team, and that they can see the broad array of patients that they're taking care of, no matter which facility they're in.
I think virtual care has actually been a catalyst to the communication, collaboration, and care coordination that's really required, because when you have patients that are outside the four walls and you have staff that's located elsewhere, they really need the ability to be able to coordinate and collaborate more seamlessly. So having a platform and having the ability to be able to do that is really important. Virtual care is here now. It's here to stay. We're actually seeing quite a bit, even within our government, where they're actually regulatory saying that they're going to reimburse more. And so I think we're going to start to see more and more of that. We're also seeing that patients are being moved out of the hospitals to do hospital at home. So we're seeing sicker patients in their own homes, and patients would actually rather be in their homes sometimes than they would be in the hospital. So I think that as we look to things like remote monitoring, ambient monitoring, we're going to see more and more ability to be able to do the virtual care, and it'll become more of a standard of care and much more common than I think even we ever thought it would be in the past.
We closed our last conversation with the idea of removing friction and bringing joy back to the providers at the bedside. A year later, with everything we've discussed, what gives you hope that we're moving in the right direction?
I have hope because I see that the systems that are being developed, things like around ambient, we are trying to remove some of that friction from the nurse's workflow to give them the time that they really want, which is to hold their patient's hand or take care of their patient, give them education, and have more thoughtful conversations with their patient. So I think ultimately, if we can remove the friction from the workforce as far as doing patient care, we offer them time back to be able to do better patient care, more quality patient care, and give them their joy back, because I went into nursing to take care of patients, and I think that's what most nurses went into nursing for. So they're really there to provide care for their patients, and ultimately that's the joy that they get, and I hear that from nurses that I talk to every day.
I think as technology evolves, it gets more fun to use. So nobody likes to stand in front of the computer and type in discrete measures into a flow sheet. They would rather be able to interact with it more seamlessly. They would like to be able to find the information that they need right at their fingertips and not have to go 15 places to go find the answer to it. They want to be able to connect with their colleagues in a seamless kind of way. So while they're taking care of the patients, they want it to be a delightful user experience, to have the technology supporting what they're doing, and I think we're moving in that direction.
Looking at everything we've discussed today, the cognitive burden, the AI revolution, the complexity of workflows, the human side of technology adoption, what keeps you optimistic about where we're headed?
We're the amount of information that any one nurse or physician needs to know has far exceeded their cognitive capacity to understand it. And so, we're, as a technology organization and group, it's incumbent on us to make it easy for people to find the right information at the time that they need it. And I think that all the technology organizations really understand that and are working very hard to make sure that we can unburden the clinicians from having to do so much discovery themselves and to be able to present it right to them. And so whether that's around communication or finding drug interaction facts or understanding the trajectory of this illness or understanding what the interaction of the lab values mean, all that information needs to be at the clinician's fingertips, and I think we as a technology organization are really helping clinicians with that burden.
What keeps me optimistic, I've been a nurse for a very long time, and I've been in information technology for, I feel, a very long time as well, is that I'm finally seeing, after all of these years, where the folks that are building the information technology and the solutions are actually talking to the nurses, that the nurse leaders and the nurses at the bedside. And I know you do that And they're actually looking at what the needs are, what the workflow is, how to incorporate it, how do we decrease the friction. So I'm very optimistic because I believe that we're actually listening to the end users, what are their needs, as well as the patient's needs. And that means to me that we're going to build solutions and systems that actually fit with the needs of the end users and the population that they serve. And I know that Mobile Heartbeat always does that.